Olfactory Neuroblastoma Virtual Community Conference Series, October 2021.
Great. Well, thanks so much, everyone, for joining us tonight. Thanks so much for joining for our second session for our virtual community conference series. Great to see everyone out here tonight. We have two excellent speakers tonight that we're looking forward to hearing from. The first one is Dr. Youngji Choi. She, as her slide says, is the director for the Primary Care for Cancer Survivors program at Johns Hopkins and assistant professor of medicine. So how we'll work tonight is we'll have Dr. Choi speak first, and then after that, I'll introduce our second speaker. And if we can hold any questions till the end, there will be plenty of time so we can ask questions. So thanks so much, Dr. Choi. Looking forward to hearing from you.
Thanks so much for having me tonight. As I was introduced, I do run the Johns Hopkins Primary Care for Cancer Survivors program. I'm an internist. I practice primary care. And so I'm hoping to provide some insight into cancer survivorship from that primary care perspective. So just so that we all are on the same page about some of the topics I'll cover today, I did want to go over the aspects of cancer care that I feel that primary care providers can help deliver and manage. And then secondly, to go over the different aspects of health that can impact cognition, which we're kind of focusing on today, and sense of well-being as it relates to cancer and cancer treatment. So I'll go over a little bit about cancer-related fatigue, mood, and some of the things we can do in terms of preventive health or health promotion to improve cognition and the sense of well-being. So also to get us all on the same page, I thought we could start with a definition about survivorship. And I really like this definition put out by the National Coalition for Cancer Survivorship in the 90s. And they describe survivorship starting at the time of diagnosis and really kind of that time period, this continuum thereafter that goes through treatment, any recurrences, cures, and through the final stages of life. I also like this definition because it not only includes the person with cancer, but also the people who end up being involved in the cancer care, so family and friends as well. So how can your primary care doctor or primary care play a role in all of this? And I think often we think of the primary care provider as the quarterback. So this long-term care provider, hopefully even before your cancer diagnosis and kind of through all of that, to be able to provide some continuity and know what has happened in your health care. In terms of the cancer, I think we can help with monitoring for cancer recurrence and also screening for other new cancers that may or may not be related to the primary cancer. I think also from an internist perspective, we could be co-managing the effects of cancer and cancer treatment with your cancer specialist or your cancer team. I think a lot of what we do in primary care is care coordination. So how do we help manage not only the health concerns that you may have, but also the doctors and other providers that may be involved. We certainly help manage other medical issues. And I think this piece about preventive care and encouraging healthy behaviors is near and dear to every primary care doctor's heart. So we'll go over some of that as well. So we'll start first with fatigue and depression, anxiety, because I think both of these areas can give us targeting these areas can really improve kind of our cognitive issues that we may have after going through cancer or cancer treatment. So there are a lot of issues I think that can occur after cancer therapy, and this kind of encompasses some of those symptoms or problems that can occur after cancer treatment. And this kind of encompasses not only one cancer type, but kind of across cancer types. So this is a little bit general, but gives you a sense of the things that we may be trying to assist with or handle. And so I think oftentimes we think of the cancer specialist as handling these areas, but I think the primary care physician can handle a lot of these as well. And one common thread, I think, across cancer types is really thinking about this depression, anxiety, and fatigue piece. So cancer-related fatigue, I think, is challenging because there's so many factors that can contribute to fatigue. So I've listed a number of things here. So often when I see a patient in the clinic who's a cancer survivor and they're telling me they're really tired or fatigued, these are some of the things that I want to go over with them. How are they sleeping? How are they sleeping? How are they eating? Has their appetite changed? Are there taste disturbances or smell disturbances that may be contributing? Pain can certainly be a factor in terms of energy levels and fatigue. We'll touch upon depression, anxiety in a moment. Oftentimes after cancer treatment, we notice that we're less active. And that can certainly contribute to how well we're feeling in terms of energy levels. So we'll go into that in a little more detail. Other medical issues, so thyroid issues, other comorbidities can contribute to fatigue. So we want to keep that in mind as well. We would want to go over your medication list and see, is there anything there that may be making you particularly tired? And also, obviously, we'd be taking into consideration what cancer treatment you went through. So accounting for all of those things is important, but I think what's we have learned with cancer-related fatigue is that there are still kind of universal things that we can consider to improve that fatigue. And exercise is one of the areas that we have the strongest evidence of effectiveness. And so we mentioned how kind of decreasing activity is common through cancer treatment for a number of reasons. And so the goal, I think, with your primary care doctor would be to think about how can we start getting you a little bit more physically active. And so that may be a process, right? So if you haven't really been active for some time, then we're not telling you to go run a marathon. It's how can we kind of help guide you through a graded process where we get you more and more active. Other things that we think about are, what we put under the umbrella of psychosocial interventions. And so it's kind of thinking through, what does your day look like? Are there periods of the day that you particularly feel tired? And are there ways that we can plan for that? And some of that may start with keeping a diary of what your day looks like and when you're feeling particularly tired, and then structuring a schedule around that. There's some evidence for yoga helping with cancer-related fatigue, also cognitive behavioral therapy, specifically around sleep as well. And then this idea of mindfulness-based stress reduction, because we do think stress and not having a plan for how to manage that can certainly contribute to fatigue. I hinted at how depression and anxiety can certainly be one of the factors leading to fatigue. And so there are lots of different ways that we can help you feel better. And so when there is a concern for a mood disorder, we would think about counseling or therapy. Also, along with that, we would consider medications. And I think kind of this counseling or therapy piece and medications is our options. But definitely having a conversation about what is the right fit for you, kind of how severe are some of the symptoms you're experiencing would help your provider figure out what that step should be. Exercise fits in here as well. Oftentimes, we talk about in primary care, the cardiovascular, the heart benefits of exercise, or the bone density, the bone health benefits of exercise. But sometimes that feels more theoretical, like 10, 20, 30 years down the road. But I think the immediate benefits of exercise can certainly be related to your mood. And so that's usually what people tell me first is, how much better they feel after they start walking outside, getting outside and moving a little bit. Yoga and meditation, I think, has a role here in terms of managing mood and some of those mindfulness-based techniques that I referenced earlier for fatigue. So switching gears a little bit, although I think these tie in really well together, I want to go over some topics in health promotion and dig in a little deeper. And so some of the topics I already touched upon, exercise, how we eat and kind of what we put into our bodies, I think can certainly impact how we're feeling during the day and how clearly we're thinking. So we'll talk about the nutrition piece and also sleep. So the National Comprehensive Cancer Network puts out a nice series of guidelines. And one of the things they do put out guidelines for is cancer survivorship. And so I've pulled a lot of my information from these guidelines, the most updated version from earlier this year. And so this looks pretty dense on this slide, so I'm going to break this down for us. But a lot of this is around, healthy lifestyles and principles. So kind of how we live day to day can truly impact how we feel and think every day. So a lot of these things are around physical activity, weight management, nutrition, sleep. And so we'll delve into this a little bit deeper, but I wanted you guys to be aware of some of these guidelines that are out there. So in terms of physical activity, I think the big message is that we should be doing something daily or most days of the week. And the idea is not to be sedentary. So yes, sometimes we have this idea of, weekend warrior and doing a lot on the weekends because the work week is so busy. And maybe we focus on getting a little more done on the weekend, but I think there is this value to trying to be physically active in some way every day. In terms of kind of goals for cardiovascular exercise, so things that get your heart rate up, cancer survivorship guidelines really say that we should be aiming for at least 150 minutes with the goal of 300 minutes of moderate aerobic exercise a week. If it's a little bit more intense, or kind of vigorous exercise, we say that you can cut that number down to 75 minutes a week. Strength training is kind of separate from the cardiovascular exercise. So we're aiming for 2 to 3 sessions weekly of big muscle groups of kind of say upper body and lower body. And like I already emphasized before, kind of thinking about avoiding a sedentary lifestyle. So I think the natural question might be, so what counts as moderate exercise and what counts as vigorous exercise? So this also comes from those NCCN survivorship guidelines. And I like the way they're described because I think that can give you a sense of what you should be aiming for. So moderate exercise is described as something where you can talk but not sing, versus vigorous exercise is being able to say a few words without stopping to catch your breath. So in general, when I think about moderate exercise, I tell people brisk walking. With vigorous exercise, something more in the order of jogging. But I think the goal with all of this with exercise or physical activity is that you have to find something that you enjoy doing to keep it up. And so I think with any of this, it's, a trial run of what you do or do not like, signing up for a gym membership. I know with COVID, I think it's a little bit more dicey, but, just signing up for a gym membership isn't the same as, taking advantage of that. And so that might not be the right answer for a lot of people. And so find something you're passionate about and you enjoy doing. Oftentimes it's also helpful to find a buddy, someone that can keep you accountable, and something that also ends up being a little bit more social. So we'll switch gears a little bit to nutrition. So I think a lot of what I'm going to outline follows kind of a Mediterranean diet, and we have some data around the benefits of that. So a lot of what we consider a healthy diet now is focused around fruits and vegetables, and kind of, I've heard a nutritionist say kind of getting a variety of colors in what you eat in terms of your fruits and vegetables. Whole grains are okay. I think sometimes lately there's this kind of anti-carb or sugar mentality, but I think kind of focusing on healthy carb or grain options is good. And so kind of looking for whole grains, so your brown rices, your quinoas, your whole wheat breads, and those sorts of things. Looking at healthy meats, we consider fish kind of our healthiest category, and then lean chicken. And then we kind of have our other category with red meats. And so there is this idea that there is a benefit to limiting refined sugars and red and processed meats. I think some patients ask me, well, how much is too much? I don't think we have any trials to tell us X amount of this is too much, but I think thinking in moderation and saying, in an average week and an average day, what are the choices that I can lean towards? I think hopefully this will give you a sense of what you can choose. Alcohol, I think as the years have gone down, this recommendation has gone towards less and less. And so I think in the latest guidelines, it says consume sparingly, if at all. So I think with alcohol, we are finding that with certain cancer types that there is this association with cancer outcomes, not all cancers, but certainly with some. And so for men and women in general, if you are going to consume alcohol, we're thinking no more than 1 drink daily. So to kind of move on to the last topic I was going to cover today, which is sleep, I thought I'd break it down into some of the do's and don'ts. And I think sleep, like a lot of the other topics I've talked about already today, is a little bit challenging in the sense that it's probably not just one thing that's creating sleep issues. If you have them, it's probably a lot of little things that maybe we could optimize so that the sleep is better. This also comes from the NCCN survivorship guidelines, some of this content. And they say that, the goal is to sleep about 7 to 9 hours each night. I think for older adults, we say 7 to 8 hours, it should be sufficient. Kind of sleep hygiene principles are to kind of have a set bedtime each night. We think about that for our children or younger people, right? That, having this kind of pattern day in and day out is helpful for sleep promotion. And probably there is some of that for adults as well. So having a set bedtime, also saving the bed for sleeping alone. So really not watching TV from bed, having your computer in bed to work from. And then some of the things that might create sleep issues, right? So extra light, having our alarm or our devices charging can create less good quality sleep. And so making sure the room is pitch black and using blackout curtains if needed can be helpful. And then I think that dreaded alarm clock, having it away from you so that you're not staring at it at night can be very impactful. So some of the don'ts. I think eating late and drinking close to bedtime can certainly impact the quality of sleep. You may be waking up more. Some of this could be from acid reflux. Even if you're not feeling kind of that burning sensation or discomfort, you may be more prone to wake up. And then, if you do drink water or fluids later in the day, that can lead to an extra time going to the bathroom overnight. And so kind of avoiding eating and drinking later in the day, close to bedtime, can be helpful. Avoiding caffeine intake after 12 or 1 o'clock as well. So usually when we think about caffeine, we think of coffee, but also think about your teas, your sodas, your chocolates. And so being really mindful about the things that we have later in the day. Alcohol comes into play here. Consider limiting alcohol if sleep is an issue. So alcohol, we know, can cause some fragmented, less restful or less deep sleep. And so that may be something to consider when you reach for that glass of wine. And then I think this is a big one, and maybe one of the hardest things for all of us is to avoid screen time before bed. Usually we say an hour before bed. So, your TV, your computer, your tablets, your phone can really that kind of even if it's like that backlit stuff that they say is supposed to be better for sleep, that can still create a situation where we may fall asleep, but that sleep may be less deep as well. And other things those are the general sleep hygiene principles. But I think, we may still have lingering sleep issues after we try to optimize those things. And so other things to consider, melatonin is a safe supplement over the counter. In general, we think 10 milligrams is the maximum dose. We don't tell people to start there. If you go to the drugstore, you may see a variety of different milligrams or doses. So they often come in 1s, 3s, and 5s. I usually tell people to start around 3 milligrams and kind of work their way up. In general, we think of melatonin as being more helpful for falling asleep than staying asleep. But because it's such a safe option, I do have patients generally try it for either of those problems. Cognitive behavioral therapy. So this would kind of come from finding a good psychologist who has been trained in CBT to kind of go over kind of the sleep patterns and things like that. There are also apps out there, podcasts out there. And I know I just said don't use your device before bed, but there are some that you can kind of start playing and go to sleep. And so Calm and Headspace, I think, have some sleep options. I've heard of a podcast called Nothing Much Happens. And so I think there are a lot of things out there that can help you fall asleep, or if you wake up in the middle of night, to kind of rely on to get you back to sleep. So just to kind of go back to our objectives, the goal of this talk for me was to kind of go over the aspects of cancer care that I felt that primary care could help deliver and manage, and to go over some areas of health that can certainly impact how we think and our sense of well-being as it relates to cancer and cancer treatment. And so kind of going over fatigue, mood, and some of these aspects of health promotion. Most of my information came from these NCCN clinical practice guidelines on cancer-related fatigue and cancer survivorship. I would be happy to take questions at the end after Dr. Vandersdal's talk. But thank you so much for your attention, and it was a pleasure being here.
Thanks so much, Dr. Choi. That was a great presentation. I'm sure we'll have some questions for you at the end. We can go ahead and transition to our second talk. This is Dr. Tracy Vandersdal, who, if you want to go ahead and share your slides, she is an assistant professor from the Department of Psychiatry and Behavioral Sciences, as well as the Department of Neurology at Johns Hopkins. And we're looking forward to hearing her talk about the cognitive effects of cancer and its treatment. So thanks so much.
Thank you for having me. I'm really excited to be here. So to sort of kick us off, I thought I would discuss and get us all on the same page by talking about our basic terminology so that you know what I'm talking about when I speak about cognition and different aspects of cognition. I'll touch on how cancer and its treatment is known to affect our thinking skills and the specific types of thinking skills that are effective. And then I really want to spend sort of the majority of my time talking about practical strategies for managing these changes, and I'll end with some resources. So what do we mean by cognition? A lot of patients will come to me and they'll say, I'm having problems with memory, because that's what we often think of. I can't remember a word, I can't remember what somebody told me. But in fact, there are a lot of different types of thinking skills. There's how quickly and efficiently you think. There's your ability to stay attentive and focus for a prolonged period. There are more advanced cognitive skills like planning, problem solving, reasoning that fall under this umbrella of executive functioning. We have language skills, so our ability to understand what's being conveyed to us as well as speak clearly and with the words we want to use. There are spatial skills, so can you put together that puzzle or that piece of IKEA furniture? Are you getting lost? And then our ability to learn and remember new information. And so we often hear about chemo brain or chemo fog. And that's a term that patients really sort of generated. And it was very helpful in getting this topic on the map in terms of research priorities and interest. But over time, we've really come to change the way we think about this. Instead of thinking of chemotherapy as the thing that's driving cognitive dysfunction, we really started calling it cancer-associated or cancer-related cognitive change or cognitive impairment. And the reason for this is that there are just a number of different factors that can contribute to your thinking skills. And so it's not simply the chemotherapy or the type of cancer you have, but there are a lot of much more sort of actionable items, right? This is much more empowering. There are things that we can modify, and there are compensatory approaches that we can take to help improve our cognitive functioning. So we aren't sort of left with, well, this is the disease I have and this is the treatment that they tell me I need and I can't do much about it. We have a lot of areas that we can really address. We know that radiation, specifically to brain tissue, can cause changes and declines in a number of thinking skills and cognitive areas. And this can happen during treatment if you're getting radiation to the brain. And for some folks, there can be sort of a delayed onset of thinking changes. But in our sort of sinonasal cancers and other types of cancers, we often don't think about there being too much direct radiation to the brain. There's often surgery or chemotherapy. And so the literature is really sparse. There's not a lot of great sort of empirical studies about the cognitive difficulties that we might expect in olfactory neuroblastomas. And so we can look to some other areas where there are similar sort of types of conditions. And this is one study out of the Netherlands that showed that in patients who were in, on average in their mid-60s, who'd had surgery and radiotherapy for their tumors, they underwent a battery of 10 cognitive tests, really looking at all of those different skills that I talked about before. And the researchers said, well, compared to folks who are the same age or of the same educational background and age, so sort of trying to make sure we're comparing apples to apples, how are patients doing? And so what they found is that more than a third, 37% of patients were showing deficits on at least a few of those cognitive tests when they were compared to their same age peers. right? So we're seeing, so most of the patients were performing in the normal range, which is the good thing. It's that 0 line here. But there's a fair number who are having cognitive difficulties. And those who are having difficulties most frequently had problems sustaining their attention and with their working memory. And when I say working memory, I always tell patients to think about, imagine I gave you a phone number and told you to walk to the other side of your house and write it down when you get there. It's that process of sort of rehearsing something, keeping it in mind, and knowing that you're not locking it down into your long-term memory. You're not going to have to remember this forever. You just have to hold on to it and be able to spit it out. And much of our life is spent in working memory. We're sort of toggling back and forth between different activities and trying to keep tabs. And then more classic memory, patients' ability to really pull up something that they learned 20 minutes ago, 30 minutes ago. That tended to be more significantly affected. But for these patients, their degree of cognitive change was not associated with their quality of life. So there seemed to be a bit of a disconnect between how they were actually, any cognitive changes they're experiencing and whether they felt like they still had a good quality of life. In fact, it really was fatigue and sleep difficulties that really drive people to feel sort of miserable in terms of their overall quality of life. Their cognition isn't the big player there. And then there's a lot of research on how chemotherapy can affect the brain. Most of this work comes from studies of women with breast cancer, but we see similar patterns in a lot of different types of cancers. And I'd like to show this slide because I think it's really nice. Across the top in that A panel is the brain of a woman completing a cognitive task. And she's a breast cancer survivor. Across the bottom is the performance of her identical twin sister who did not have breast cancer. Ultimately, they performed the same on this challenging cognitive task. However, the amount of brain activation that the cancer survivor had to show, how much activity and how much effort they had to show to create that normal performance was much more than her unaffected sister. So we see lots more of the brain activating, lots more sort of oxygen being used sort of as the fuel to drive cognitive performance. And if you think about having to rev your engine that much harder on an everyday basis to perform normally, you can see how you can have cognitive lapses and difficulty with some of your normal everyday tasks. You may be more forgetful, have more difficulty finding the words that you want to use, and just generally feel like you're not quite as sharp. So what can we do about this? And as you already heard so nicely, that a lot of our feeling that we're not performing well cognitively and our quality of life, it's really driven much more by mood and fatigue, more so than our actual ability. So if I bring you into my office and I have you do a bunch of tests of thinking and give you questionnaires about your mood and your fatigue and sleepiness, that mood and fatigue and sleepiness is more likely to be sort of contributing to how you're feeling on a daily basis than whether you can remember as well as you used to. So there are a number of things that we can do to help simplify our thinking and make ourselves a bit more efficient. And one is using compensatory strategies. This is really using your areas of cognitive strength to help work around those areas that are weak for you. And sometimes we have to really practice this. It's hard sometimes to create new habits and new ways of doing things. So we have to be patient with ourselves, remind ourselves gently that we're going to try to do things a different way and see if we can't make a difference in how we're thinking. And one of those ways is to really be active in the way that you're listening. So you've been sitting here, or probably about a half hour, 40 minutes in now. It's natural for your brain to sort of take a break, to check out, to think about something else. And so we gently remind ourselves to bring our attention back to the task at hand. If we're wanting to learn something new, we want to try to think about it as deeply as possible. So try to take notes in handwritten rather than typed, rephrasing into your own words, really having to process what you're hearing and what you're learning. trying to visualize new information and really make it rich. Additionally, we often think of memory as somewhat like a file drawer. If you aren't doing that good, rich paying attention part, you've never opened the drawer and put the file in. So there's no way you're going to be able to pull it back out. Patients often say, you know, my memory is poor, but we find that really their attention is what's lacking. They're not quite in the moment as much and paying attention to what's going on and what they should be attending to. So I often tell folks to make sure that you're, you know, reminding yourself, and if you notice that your attention is waning, gently pull yourself back. And then it's true that repeating things really does help sort of strengthen those associations in your brain. So if you know you need to pick up 5 things at the grocery store, challenge yourself a few times during the day and say, okay, let me try to think of what those are without looking at my list. And that sort of makes it easier. The more you sort of pull that information up, the quicker the route is to that information. Additionally, it's never been sort of easier to use compensatory strategies to be able to give our memory a rest. We can take notes, we can use technology. The key is really to use these tools consistently in a way that works in your life. So writing down a new sticky note for everything and having them all over the place is not likely to be effective in the long run. Some people find that just having a 3x5 note card in their front pocket that they jot down important things throughout the day on is really helpful. Other folks really love to use their smartphones and use sort of all of the Google tools and to-dos and Evernote that let you take videos and pictures and sync with all of your family members. There's a whole lot out there that can be sort of used and you can capitalize on to help improve your thinking. We also know that in addition to getting a good night's rest for just our general quality of life, that our memories are consolidated or made much more stable and permanent throughout the night as we sleep. And so one thing that can be helpful is to, as long as it's not sort of stressful for you, doesn't disrupt your sleep, is to think back over your day and think about the highlights. What were the important things that happened that day? And just sort of do that refresh. And that information and those facts are more likely to sort of get settled in and be easier to call up later. That's why it's always, the late night cramming tends to work fairly well because it gets in there while you're sleeping. Word finding is, for some patients, it's really, really frustrating. They find it very challenging to be in a conversation with someone and all of a sudden find that they have that tip of the tongue. They know they want to say a particular word and it's just not going to come to them. And so for that, our strategies are to delay. So give yourself a pause, give yourself a few seconds and see if it percolates up to the top of your brain and you're able to come up with the word. You can cue your listener in. You can say, oh, it's not that. It's sort of like it. You know what I mean? Everyone's had that tip of the tongue phenomenon, no matter how young or healthy they are. So they, really, it's so universal. They appreciate when somebody can't find the right word. And people generally, I think, really want to help out and are willing to chime in and help come up with the word for you if you sort of show that you're open to that. Additionally, we know that we're not meant for multitasking. We don't text and drive for a reason. We never actually do 2 things at once. We always just shift, and we lose efficiency as we go from one task to another. So whenever you're able to, it's really best to try to focus on one task at a time, to break that task down into its parts, maybe actually make a list, a checklist, and get one thing done before you move on to the next. And try to do so in an environment that's quiet. It may be the case that you used to be able to work in a loud, with music around and people nearby. That's maybe not always going to be the case for you. Sometimes people feel like, I need to shut my door. I need to put on white noise. I need to give myself a chance to be as efficient as possible. I need to turn off all of those alerts. If you're an email alert person, a social media alert person, turn those off. Give yourself time to really focus on the task at hand, and then you can turn all that back on when you're done. Then I often also get questions about just generally how to maintain our brain health as we age, whether we've had a disease or not. And I think the good news is that the research says that there's no one sort of magical activity. If you don't like crossword puzzles, you don't need to do it. You don't need to buy expensive brain training games if you don't enjoy them or have the financial means to do so. The research really tells us that doing things that are new, they're novel, and challenging, but not outside the realm of possible. You don't have to learn a new language in order to maintain your brain health. You can do things like watch game shows, take an art class, or go to museums and listen to the lecture. Doing things like this, you're attending a lecture, you're learning something new, and doing things that involve other people just inherently sort of ratchets up the novelty because they are going to be spontaneous, and your conversations can go in new directions. The elderly sort of adult aging literature actually shows that ballroom dancing is really, really great at maintaining cognitive health. And it makes sense. It's physical, which we know now is really good for our mental functioning. It's social. You're reading somebody else's activities. You've got to be sort of in the moment and trying to sort of work with them. So it's really multimodal, but there are a lot of different things that you can do. You don't have to do Dancing with the Stars. And more broadly, our ability to compensate for any difficulties that we're having cognitively really spans. You can do things that like cognitive behavioral therapy. Some folks will feel like maybe they want to try a stimulant medication if they're feeling very sort of cognitively fatigued. There are cognitive rehabilitation interventions where patients go and sort of really work on streamlining and applying their approach to improving their cognition sort of in their daily life. We've talked about staying mentally active, being attentive, sort of forming these good cognitive habits for ourselves, and then all of the basic self-care in terms of exercise, good sleep, good nutrition. Additionally, another resource is a neuropsychological evaluation. And so that's what folks like myself do. We bring you into the clinic, we talk with you about your particular cognitive concerns, your life, and what sort of demands are placed on you. Some folks are trying to get back into the workplace, and we can think about return to work interventions. But we put you through a little battery of tests. We see what your personal strengths and weaknesses are. We help decide on some compensatory strategies that are really tailored to you and your pattern of strengths and weaknesses and your needs. And we can also help direct you to folks to help with sleep hygiene if you need an intervention for that. If you're finding that you're drinking a little bit too much, we can get you into mental health counseling to help reduce alcohol, nutrition to help you get on a better nutritional path, all those kinds of things that we now know are important for our cognitive health. We can really sort of help guide you there. I also appreciate that neuropsychology is a sort of a new field for many folks. They don't necessarily have experience with a provider, and so people can go to the American Academy of Clinical Neuropsychology to find a board-certified neuropsychologist in your state or your area, and those are folks who are going to be able to sort of get you on the right path if you have further concerns. And so that is the last slide I have. I'm happy to field any questions that people have.
U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov, 1-800-4-CANCER.